name's Bill Evans. I'm a economics professor here in the Department of Economics at the University of Notre Dame, and I'm one of the co-founders of the Wilson Sheehan Lab for Economic Opportunities. And what we're going to do in this talk is really four things. I'm going to give you a little bit of outline of what LEO is, and what we do is conduct impact evaluations. And so I'm going to outline exactly what they are, why we think they're important. We're going to discuss some ethical considerations about the work that we do, and the overall stopgaps that we have in the procedure to make sure that everyone's treated with respect and dignity. And then we're going to outline our project that we have with a high recovery housing, and some ways in which if you're a house and you want to be involved in that evaluation, it would be great to have you participate. So LEO is a research center that's interested in finding evidence-based solutions to poverty. We believe that a lot of the great ideas for not only reducing poverty, but reducing the toll that poverty takes on families are at the local level. These social service agencies interact with the clients on a day-to-day basis. They see what their needs are, and they have innovative solutions to the problem. And so we primarily interact with social service agencies, and we try to build in an impact evaluation into their projects to answer the question, are they delivering as promised? We're interested in this because there's 37 million people in poverty, but more importantly, we're spending about $1 trillion in state and federal dollars fighting poverty, and it's not clear that we're getting the best return for those dollars. And so we want to be able to understand what works, what doesn't work, because people in poverty deserve programs that work. The worst thing is to have them engaged in something that's not going to provide changes in outcomes for them. So the way we work is we spend a lot of time trying to find innovators at the local level who have innovative ideas about how they can impact the lives of their clients. In order for us to understand and have the best evaluation possible, they have to understand our business and we have to understand theirs. So we spend a lot of time talking to them, figuring out exactly what they do, but at the same time, we have to teach them about what we do, which are impact evaluations. Then we try to overlay a research design on their current programs. Along the way, we think we're going to learn something not only about the overall impact of the program, but some specifics about the way the program operates. We're not interested in doing this just to have academic papers. We want to share our findings with policymakers, social service providers, philanthropic organizations that might fund local social service providers, about what programs are actually delivering as promised. We're also interested in programs that can be scaled. If a project is working primarily because they have a really stellar case manager, we can't replicate that case manager, but at the same time, if they have a program that has a good curriculum, that's the thing that we can export to other cities. We have focus areas in education, health, housing, criminal justice, self-sufficiency, and emerging issues. Like we have a big project on foster care right now. And our work with a high recovery housing really spans a lot of these: health, housing, criminal justice, and self-sufficiency, because the services that you're providing can have impacts along many different domains. We have a staff of about 34, and we really work as a faculty affiliate network. The problem is bigger than just Notre Dame, so we have faculty members here that work on projects, but we try to contract with faculty members across the country to work on our evaluations that have expertise in particular subject matters. So we have about 67 faculty members from around the country that are affiliates. We've got about 74 partners in 81 projects. We're in 48 communities in 22 different states. So we have a fairly broad range, and we've literally been from Albany to Anchorage in terms of projects. The primary thing that we do is an impact evaluation. Now, impact evaluations are a subset of all evaluations. Most social service agencies are engaged in some sort of evaluative process. They might be interested in measuring inputs into the process, how many dollars are being spent, how many hours are being devoted, how many clients are going through the system. They could worry about things like, is a program being implemented with fidelity? So these are all particular types of evaluations. Impact evaluations is a subset that really focuses on a specific question. What are the changes and outcomes that can be attributed to a specific intervention? And so that question is going to be very specific to the services that are being delivered. And so you want to work towards finding outcomes like some of the ones that we found in our work. In the state of Indiana, they have a program where adults can go back and get a regular high school degree instead of a GED. They're called Excel Centers and they're run by Goodwill. We had an evaluation and we found that people that graduate from Excel Centers have 38% higher earnings compared to applicants that do not enroll. We've had two different large-scale evaluations of services that are providing temporary financial assistance for families that are at an imminent risk of being homeless. And in both of those situations, we found that homelessness falls by 80% for those who receive services. We had a large-scale evaluation of a wraparound service program that increased earnings by 38% over a 2-year period after program enrollment. So we want to work towards that goal of answering that specific question. Now, what do we need to have an impact evaluation? And there's really 4 things. The first is a comparison group. We're going to spend a lot of time talking about that because that's, I think, the most important. You have to have measurable and meaningful outcomes. You have to have a large enough sample size that you can make statistically precise statements. And you have to have a well-defined intervention. And we'll talk about each of these in turn. We're going to spend the most time on talking about the comparison group. And the easiest way to indicate the importance of a comparison group is to examine a situation where we don't have one, and you can see how that poses particular problems in an evaluation of an intervention. A particular example I want to focus on is something I'm fairly familiar with. I've done a lot of work on different programs to discourage smoking and drinking. Back in the late 1990s, all states filed suit against cigarette manufacturers to recover damages to state budgets as a result of cigarette smoking. Most of those damages were concentrated in state Medicaid programs. The states eventually all settled out of court with tobacco manufacturers, and states agreed to the cigarette manufacturers agreed to provide states with $250 billion over a 25-year period. That was the largest out-of-court settlement that had ever been constructed at the time. Florida's return on this investment was going to be about $11 billion. And what Florida did with some of the money is construct this very aggressive anti-smoking campaign called the Truth Campaign. The Truth Campaign was a very edgy campaign that had fairly in-your-face type advertising, primarily designed towards teenagers to discourage them from smoking. And the reason they had to focus on teenagers was that 90% of smokers begin before the age of 20. So if you can prevent a teen from smoking, chances are you're going to prevent them from ever smoking in their life. The conclusion of the study was that these advertising campaigns had a significant impact on reducing teen smoking. A team of researchers concluded. What did they find? They found that in 1998, before the program went into effect, smoking rates were 27.4%. And then by 2000, a year after the program was started, they were down to 22.6% among high school students. And so essentially the evaluation was this graph. That's what it was. Well, what's the problem? The problem is that the way the out-of-court settlement was reached between the states and the tobacco manufacturers is that the states agreed that the way in which they were going to fund this program was that tobacco manufacturers had to increase the price of the cigarettes to pay for the settlement. And so essentially, they agreed to fix prices. Now, what does that mean? It means that prices went up considerably as a result. And in fact, the day that the settlement was released, prices went up went up 43 cents in that day alone. This is a graph that shows in the gold line the average retail price in cigarettes and what's happening to consumption over time in billions of packs of cigarettes. And what we see is that over a very short time period from 1998 through 2000, cigarette prices went up $2 a pack. And so if we go back to the graph that Florida presented, is it the case that the only thing that's happening over this time period is that there was an edgy advertising campaign that discouraged teen smoking? Well, no, cigarette prices are going up. The law of demand affects teenagers as well. And so as a result, we expect that demand should be falling for teenagers as well because they just have to pay more for cigarettes. And so what we need is to ask the question, what would have happened in Florida had they not had this edgy advertising campaign? Well, we can figure that out by taking a look at the rest of the states because they did not have the truth campaign at the time. And so therefore, if you take a look at that and you graph what's happening in the rest of the United States, cigarette smoking is falling about the same rate as it is in the state of Florida. And so it's hard to reconcile the results in Florida and say it's only the advertising campaign because there's this massive change that's occurring in other spectrum as well. Prices are going up, and we see that the other smoking rates in the other states are falling nearly the same degree as they are in Florida. So teen smoking declined in Florida, but in the rest of the country, it saw a similar decline without these anti-smoking ads. So I think a fair conclusion is that the Truth campaign had little impact on smoking. All right, so we need a comparison group because what the comparison group does for us is answer the question, what would life be like had this intervention not been available to individuals? And so a lot of our work is trying to find an appropriate comparison group that we can compare people that receive homelessness assistance or case management services or free bus passes, whatever the case might be, to use as a counterfactual what life would be like. Now, in many situations, we have to get the agency to think about their project a little bit differently. And I'm going to describe a situation we had with an organization in Rapid City called Catholic Social Services that was running a program called Uplifting Parents. That was a very innovative program that was designed to encourage college completion rates for single parents. If you take a look at college enrollment now, there's really no shortage of people that are going to college. However, there is a completion crisis in that a small fraction of people actually are getting degrees, especially people that attend community college. Uplifting Parents is trying to deal with the very specific problems that single parents have, which is they have to juggle work, raising their children, going to school, which sometimes can be an incredibly difficult task. And so the way Uplifting Parents works is they have this 31-member coalition group that provides social services in the Rapid City area that finds single parents that are either in college or about to enroll in college that are eligible to be part of the program. This is a vulnerable but very motivated population. And the staffs of these agencies are very dedicated and innovative. And to be a coalition member, what you have to agree to do is provide services to one of the participants if they need your particular services. So Catholic Social Services can't do everything. Sometimes people need help with domestic violence. Some people need help with drug and alcohol use. And so the coalition members are there to help the particular participants. The way the process used to work when Catholic Social Services came to us and said, we would like to evaluate what's going on, is we had them describe their enrollment process. Now, at the time, there were, and still the case now, there were a lot more applicants to the program than they had slots because it was a relatively small program. So coalition members would nominate people, Catholic Social Services would screen them, they would present biographies of all the participants to the coalition, and then the coalition would vote on the 5 or 6 people every 3 months who they thought were gonna most succeed in uplifting parents. They would invite them to participate. So they would typically get maybe 15 to 20 applications. They would enroll 5 people every quarter. But they were enrolling people who were highly motivated, who they thought had their act together in order to participate in this program. So they came to us and said, hey, we would like to do an evaluation. Can we compare the people that are in the program with those that we didn't invite? And the problem that we have in that situation is that they have an applicant pool. And within the applicant pool, there are very highly motivated people, highly talented. And then there are people that are less motivated and less talented. And through the screening process, what they're doing is trying to identify these people that are more motivated. And so essentially what happens is that the highly motivated are asked to apply where the less motivated are not. If we were to compare these two, we would have a comparison group. But the problem is they would not be identical. And if the screening process that the agency is using to identify who's the most motivated and most likely to succeed in the program has any efficacy whatsoever, you're not going to be able to tell, is the program due to the screening or is it due to the program itself? So what we asked them to do is to do the following. What we need is a group that looks exactly like the group of participants in all ways, but one, exposure to the program. And so the way that we do this is through, in this case, a random assignment experiment. So there's a bunch of eligible participants, and instead of inviting people that are highly motivated, we invite a particular group of them. On average, those two groups that are invited and those that are not should look the same. And therefore, if we see some different outcomes at the end of the day, we can attribute it to the program. This, however, required that they change the way that they do the process. And they were open to doing this, and it eventually was the way it was adopted. So there's a nomination process, there's an evaluation. Now the coalition members don't vote on who's the best, who's most likely to succeed. What they vote on is this person ready for up, and do they think they're going to succeed? And so among that group, then we have a lottery because we still have excess demand for the program and invite people randomly to join. And so therefore, the way you want to think about it, it's the same applicant pool before, but instead of just asking certain people to join, we're going to ask the people that we think are the most likely to succeed, invite some of them to participate and others to not. And so now the two groups look identical, and the comparison sample can provide for us what is an indication of program success that would occur had these people not been available, been invited to participate in uplifting parents, okay? The second component that you need for an impact evaluation is you need meaningful and measurable outcomes. And so in this particular case, you want to have something that is directly related to the program of interest and is in some degree relatively easy access and measurable. So we had an intervention out of Fort Worth, Texas that was similar to Uplifting Parents, and it was an effort to try to encourage low-income students to complete college degrees. Again, there's a college completion crisis in community colleges. It really negatively affects low-income students. And as a result, what we were interested in doing was providing them with some financial assistance and with some detailed case management that would help them smooth over the rough spots that occur in their day-to-day life that are going to threaten their ability to complete a community college degree. So, for example, this is in Tarrant County, Texas. They have almost no public transportation, so everyone has to drive to school. If their car breaks down, they're not going to be able to make it to school. They need to have their car fixed. There's some financial resources to help them. One student used to get headaches all the time when they went to school. The case manager took them to the eye doctor. They got glasses. The headache stopped. They were able to complete their degree. And so the case manager uses some financial resources to help make sure shocks that occur aren't going to prevent people from graduating. Well, what's the goal of the program? The goal of the program is to encourage people to get a community college degree. Thankfully, there's this administrative data set called the National Student Clearinghouse that virtually all colleges and universities belong to, that every quarter they provide data of who's enrolled in their school, who has recently received a degree. And so long as you have some personally identifiable information about study participants, you can see whether they're in school, they got a degree, without having to talk to them whatsoever. So in that particular case, the meaningful and measurable outcome is coming from administrative data. In a lot of situations, we want to follow people electronically. People generate an electronic paper trail when they go to the doctor, get arrested, work in the covered sector for unemployment insurance. They enroll for SNAP. They enroll for TANF. We try to use these administrative data sets because surveys are expensive and administrative data sets are much more general in terms of scope. We don't necessarily have to worry about tracking down people in order to interview them. We're going to let their interactions with state and local governments provide the information for us. The third thing we need are ample sample size. Everything that we're going to be doing is producing a statistic. By how much did earnings go up? By how much did homelessness decline? By how much did high school graduation rates improve? These are all going to have statistical noise associated with them because we're going to be comparing two groups, treatment and control. And so in order for us to say something definitive, we have to make a guess at the beginning of the process of how many people we need in the study in order to reduce the statistical noise in the data to make a definitive prediction about how the program is going to change outcomes. And so that's what's called statistical power. And we spent a lot of time talking to agencies about how many people enroll, how many people you think are going to be interested in this program, and then what do you think is the impact on the potential outcomes that we're going to be measuring. Now, in a lot of situations, the sample size is limited because we're taking a look at sometimes very small social service providers. And so what we need to do is use time as our friend. And so we had this program that we evaluated. It's called Reading for Life. It was a diversion program for juvenile offenders who had a first-time nonviolent offense. And it was really a virtues education program that was based around a bunch of different books that the students would read. And the goal was to make sure it was to try to decrease recidivism for the first-time offenders. In this particular case, you typically like to follow respondents for 2 or 3 years after they enroll in the program. It probably takes about a year for the program. So you're in this game for at least 4 years if you want to get the right outcomes. Well, the problem was that the number of people that go through the program in an annual basis is not very large. So what we had to do is enroll people for 3 years. We had to follow them for 3. So this ended up to be a 6-year investment on our part. In this particular case, we found that there was very large declines in subsequent recidivism rates for the people that were involved in the program, so the treatment seemed to have a very large effect. So in all situations, we try to make a guess of what's the sample size that we need in order to make definitive predictions. The last big characteristic that we need of a successful impact evaluation is a well-defined intervention. And The way I like to describe this is that what you need is an intervention that you can describe to someone else if they want to start it up. So, for example, if some city comes to you and says, "Hey, we see what you're doing here in Boise. We want to implement this in San Antonio." You have to be able to describe to them exactly what's going on. So maybe the best example is emergency financial assistance programs for people that are imminent risk of homelessness. So suppose a family has received a notice that there's an eviction that's occurring or their power is going to get shut off. There are virtually every city has a 211 or a 311 number that you can call to sign up for financial assistance. In that particular case, the cities have specific rules about who the money can go to. Your incomes have to be below a certain threshold, and it has to be the case that the money is going to solve the problem permanently, not necessarily just temporarily. So if you have someone who has never worked and suddenly they find themselves with an eviction notice and they have no hope of working, in most of these situations, the emergency financial assistance is not paid because it's not going to solve that immediate problem. You try to send the person to other services. So in this particular case, there's a fairly well-defined intervention. We have eligibility criteria. We have limits on how much income you have. We have limits on how large the debt is that you have to pay in order to resolve the financial crisis. So this ends up to be a well-defined intervention. So what we hope is people have some manual at the end of the day that when San Antonio calls, you can give them the manual to let them know exactly what your program is doing. So given that we have some notion of what an evaluation is, an important set of questions is why you might want to evaluate. So there's really three reasons. You want to understand your impact, you want to learn from your nose, and you want to inform the conversation. So let's go through each of these in turn. First of all, let's go back to the definition of what an impact evaluation is. What are the changes and outcomes that can be attributed to a specific intervention? You want to be able to tell donors, you want to be able to tell participants, you want to be able to tell the people that hold the grant that pays for your services exactly what your program is doing. As grant dollars become more competitive, knowing exactly what the return to that investment is actually a really important competitive advantage in the fundraising competition. So a lot of times there's immediate outcomes, and that's what the program is designed to address. But a lot of times there's going to be downstream outcomes that you want to follow as well. So a program might be designed to reduce homelessness, but in the process, it could also improve job prospects or improve a client's mental health. And so in terms of informing the conversation, you want to have as broad-based of a picture of the likely outcomes that are possible. And that's certainly the case in recovery housing. I mean, why is there recovery housing? Well, a primary goal is to assist the clients with their post-treatment sobriety. However, in improving sobriety, you could be enhancing their housing prospects, their overall health, their criminal justice outcomes, or their earnings and employment histories. So you want to catch as many of those outcomes as possible. The more downstream, it's going to become more difficult to get statistically significant results, but you want to make a stab at figuring out what the universe of those outcomes are so you can collect the appropriate data. The other important characteristic about evaluation is that you want to learn from your nose. And what we mean by this is that the important characteristic of any impact evaluation is the comparison sample. You have to have a group of people that represent what life would have been like in the absence of the intervention. Well, the sad fact is for most social service agencies is that there's excess demand for their product. And therefore, the number of people that you can help with housing assistance, with case management, with immigration services is a lot smaller than the people that are eligible for those services. Given the fact that you have some people that are being turned away, you want to use that in a constructive way in constructing a comparison sample to figure out exactly what the program is doing. Finally, you want to inform the conversation. a generous aspect of virtually all the social service providers that we worked with is that they understand that this is not a problem that's just unique to their local area. Typically, they're attacking problems that a lot of other communities have. And so you want to know, does the program work, not necessarily just to help Chicago or Cleveland, but you want to know whether it works because other people are facing the same type of problems. So we had one of our first evaluations was a homelessness prevention program in Chicago, again, that provided people with emergency financial assistance if they were imminent risk of being homeless. And we found that it reduced the probability of shelter entry by about 70%. So the program was incredibly successful. Now, why is that important? I don't know whether you people understand or know the finances of the state of Illinois. State of Illinois is a financial train wreck. They have very large unfunded pension mandates for state employees, and as a result, they're always looking for ways to cut money. Well, we did an evaluation of the homeless prevention call center and their use of emergency financial assistance in a budget, a proposed budget at the state level. They had zeroed out almost all the homelessness assistance. The individuals that were part of the continuum of care there in Chicago was able to go to the state capitol and say, look, you're taking our money away, but we've had this evaluation that says our program is actually working as designed, and we're reducing the chance that someone is going to end up in a homeless shelter by 70% when we give them resources. How many of these other programs have that? And they were able to save funding for the homeless prevention call center and some of the emergency financial assistance. And so it's not all about funding, but a lot of it is. I mean, and dollars are becoming scarce, and you never know when the next group of politicians is going to be wanting to zero out your program. So having the evidence that the program delivers this promise is really important. Everything we do is regulated by what are called institutional review boards, which are boards that are set up at universities that review all of the research that is dealing with human subjects. And so if you had a new drug that was supposed to reduce cholesterol levels, you would recruit a group of people that have high cholesterol levels, give some of them an active ingredient, some of them a placebo. The institutional review board would review everything that you're doing just to make sure that no harm is going to be done. So all of our work that is done at Leo is dealing with human subjects. So we go through the same institutional review board process as well. The core principles of institutional review boards were established by the Belmont Report, which was released after the atrocities of the Tuskegee experiments were released, where a large sample of African American men with syphilis were allowed to live out their life with syphilis without telling them what was going on. So in any study, there are three principal elements of an experiment that have to be met. The first one is to do no harm. So there's nothing that we could be doing that could be making things worse. So for example, suppose that we had a social service program that wanted to be evaluated, but they were serving everybody. We couldn't withhold services to someone in order to get a control group. So we have to look for programs that actually have excess demand from the start. We can't go into a situation, take services away from a person in order to construct a comparison sample. The second thing we have to have is respect for the person, which is they have to be informed about everything that could potentially affect their outcomes and their livelihood and their health. And so therefore, we're always asking people to take a look at what the specifics of the experiment, what the specifics of the impact evaluation are. Here are some of the likely outcomes, and we ask them if they want to participate or not. And so in most situations, people are willing to participate. They understand that there's some inherent benefit associated with this to the general population, and so they're very generous with their participation. But sometimes people are more wary of giving their consent, and they say no. Finally, there has to be some justice involved. You cannot just recruit groups out of convenience. So, for example, there used to be a lot of experimentation done in prisons and in mental health hospitals because that was a contained group that you could easily randomize and follow over time. You have to have a group that is not just convenient, but also somehow reflective of the dimensions of the problem. So one example I always give is that a lot of the heart medicines that were developed over the past 40 or 50 years, the initial random assignment trials were all done on men. And they weren't done on women. All heart disease affects women as well. And so a lot of times we release a drug on the market and we have no notion that that's going to work on women because they weren't part of the RCT. So you need to include women in the evaluation as well. In any of this, there's a balancing of priorities in what we have to do with what is you're trying to do on the ground. And so, for example, you're trying to help as many people as possible. However, we have to maintain a comparison sample. So the way that we construct the comparison sample has to be in line with the way that you're delivering services, okay? The agency wants to target the right people, but in a lot of situations, we're trying to do random assignment in order to get an appropriate control group. So we have to balance those two opposing forces. A lot of times we're asking social service agencies to do a baseline survey for us or to consent individuals to participate in the research. Well, the problem is you guys are stretched for time. There's not an abundance of resources. You don't have very large staff. And so as a result, we have to collect the information in a way that's respectful of the constraints that you're facing on a day-to-day basis. Finally, we always have to protect client confidentiality, but at the same time, we need outcomes for this group in order to measure them. So we have to collect the data and protect it in a way that protects the privacy of the client to the highest degree, okay? The last topic that we're going to go over here is just some notion of what we're trying to get with our evaluation of higher recovery housing. There are about 18,000 recovery homes across the country, serving about 250,000 people on an annual basis. And we want to test the impact of high recovery housing, the only NAR certified homes in Ohio. There has been some prior work that's shown positive impacts on self-reported recovery and employment, and our project is going to try to solve some of the limitations of prior work, which was very small samples. Our evaluation, we think, is going to be substantially larger than previous research. Most of the previous evaluations were done in very limited geographic areas on one specific program. We're going to have a diverse communities across Ohio that are participating. And the outcomes tended to be limited because they were using survey data. We're going to try to take a look at rich administrative data to get a whole host of outcomes from their participation. The reason why studying higher recovery housing is important is because the drug crisis in Ohio is particularly acute. And so if you take a look at the highest drug poisoning death rates from 2016 to 2020, I should update this now. The 2021 data is now available. Ohio is third highest, tied with Delaware in terms of drug death rates, behind only West Virginia and the District of Columbia at 39.2. Just to give you some reference, this is about 12 times what it was, say, in 1980. It's just a staggering increase in drug deaths over time. If you take a look at drug deaths for the United States versus Ohio, they were tracking reasonably well until about 2009, where the deaths in Ohio just went off the charts. The research design that we have in this is designed to answer the question, does the NAR certified recovery housing in Ohio improve health, housing, and employment outcomes for those with substance abuse disorders? The way that people typically enter a high recovery housing right now is someone is exiting drug treatment, or maybe they're exiting prison. They are looking for recovery housing in their local area. And so a new potential client calls a recovery home inquiring about availability. The provider checks for eligibility and interest in the program, and sometimes people are offered a bed if it's available. Otherwise, they could be referred to other resources or placed on a waiting list. And again, the sad fact is that most people aren't necessarily getting into the housing the first time they call or ever, because there's just such a high demand for recovery housing. And so what we want to do is sort of introduce the study at this particular point in the process. We want to consent individuals to participate in the study, and we want to follow and see, were they offered a bed? Did they actually enroll? With the notion being that if you weren't offered a bed, the chance you're actually going to find one in another situation is actually limited. And so from the provider's perspective, when a client calls, they briefly introduce the study. They invite individuals to participate and sign a consent form for them to participate. And we thank them by giving them a $10 Visa card for their participation in the study. We're going to keep a log of everybody that's offered a spot that consents to the study, when they move in and when they move out. The provider's going to have some routine check-ins with the LEO team to see how it's going, what the excess demand is for the program. From the client's perspective, not much is going to change. It's just in the middle of this process, we're going to say, look, we're doing this study on the impact of recovery housing. Would you like to participate? It's not going to take any time on your part. It's not going to change the chance that you're going to get recovery housing. If you agree, there's a few short questions that you need to answer. We'll give you a $10 gift card. But if you don't agree, you can skip the questions and the gift, and your probability of replacement hasn't been changed at all. Okay? The researchers are not going to contact the clients whatsoever. We're going to try to follow the people all through administrative data to try to find the outcomes, which are going to be mostly socioeconomic in nature, and go from there. Okay? So in this particular case, what is the treatment group? The treatment group are going to be those people that are offered placement in recovery housing, and the control group are going to be those who, because the house was filled, they were unable to receive a spot in the recovery housing at the time. Okay, we're going to collect data on those who consent, and we're going to try to collect information on health, housing, and financial well-being. The health data we're going to get from emergency department admissions and inpatient hospital stays from Ohio Medicaid. Virtually everyone in recovery housing, I believe, is on Medicaid. Housing outcomes, we can follow people in local HMIS systems, but there's also consumer reference data sets that indicate where people live and when they're showing up, that we can sort of measure some housing outcomes. And then we have some measures of financial well-being. Are they enrolled in state social insurance programs like TANF or SNAP? We can get quarterly earnings by their enrollment in the unemployment insurance system. When you work in the covered sector, when you have a job, every quarter the firm is taking a small fraction out and paying it as your unemployment insurance payments. So we have a pretty good measure of your engagement with the labor force, and all this data you can get through agreements with the state for research purposes. We're going to have, we can have mortality data from the Social Security master death file. We also get credit scores and credit card data on a routine basis from Experian for our all of our participants in our studies. Okay, just to give you some notion of the current project status, we have 7 homes that have agreed to participate in Akron, Springfield, Dayton, Parma, Vermilion, and Cincinnati. We of the 7, 2 are recent additions that have agreed to participate, and hopefully we're going to be taking consent forms for those as well. Those are Phoenix and Canton, Ohio, and Kathy's house in Medina. All right. So that just gives you a little bit of status. Oh, we've been up and running since April 2022. We've enrolled about 320 people in the study. Unfortunately, most of the people, from a research standpoint, from a social standpoint, it's great. Our end up to be the treatment group. Very few people, a small fraction weren't able to get houses. So they're not necessarily in balance, but a large enough sample will take care of that. We're going to hopefully continue to enroll for 2 years or until there's sufficient sample sizes reached. That's going to be a function of how many homes we can actually enroll into the study. Okay. So that ends kind of the formal portion of my presentation, and I can answer any questions people might have at this particular point.
Yeah, if everybody could just, if you have any questions, use the question tab on the control panel of the PowerPoint. And we do have a couple, so might as well get started. So you kind of went over this, but this is all, you're gathering data behind the scenes. So once the resident signs up,
Yeah,
the resident is not involved. You're just gathering data from all the other sources.
that's correct. We're trying to minimize the contact. So there's a lot of information you can get from surveys. The problem is surveys are incredibly expensive, and this is a very difficult population to survey because they're going to move frequently. They're going to change cell phone numbers frequently. And so as a result, that ends up to be very difficult to do. We can get a lot of outcomes through administrative sources, and that's what we're going to try in this particular case, is to try to get a better overall picture of their life by having as many different administrative sources as possible.
Yeah. How many houses in Ohio? I mean, you have enough houses, or you want
We're
lots
always
more?
looking for more. I mean, it's this ends up to be a very difficult question. So the one limitation of the research that's been done so far is they've only been done at one house, like at a time. And so the fact that we can have a large number of houses that have the same underlying sort of regulatory environment is actually a benefit of the study. So if anyone's interested in participating, you can contact Danielle, I guess, and she can put us in touch with us. But we're always looking for new partners.
Yeah, great. And so yes, just to tell everybody, if you have any questions, you can reach out to ORH. Best email address is the info at ohiorecoveryhousing.org email address. So what kind of when are you going to get that critical mass of the sample size? Because it's all about getting those numbers. And
so we've had a little bit of turmoil at the beginning of this. A lot of it was generated by COVID. I mean, this was delayed considerably because of COVID. And there was some, but I think we have a good group of homes right now, and the process is pretty well set. I think if we enroll for another 18 months, 2 years, we'll be in pretty decent shape, and we'll be able to take a look at things then. But we're going to hopefully take a look at some preliminary results, maybe sometime during this winter, and get our first data pull from the state. That takes a while to sort of get that procedure ironed out. And so hopefully we're going to iron it out the first in a trial run with the data and with some preliminary estimates, and then have a final data pull a little bit later on.
Yeah, it's really about that crossing that threshold where you have enough number to make predictions. Yeah, I think it's very important what you're doing. But we have two. I'm sure you know about the outcomes tool survey.
Yeah.
Yeah. Okay. So just to to explain to everybody that this is different than the outcomes tool, because the outcomes tool, the resident takes a survey 3 times. Move in 6 months, move out. Where this is, once the resident signs up, gets their gift card, it's just to reiterate, it's all behind. The resident doesn't have to do anything else. You're just following from government statistics.
So we've been taking a look at the outcomes data that ORH already collects, just to get some sense of the population and how this has changed over time. And what's amazing is sort of the the changing composition of drug usage for the
Hmm.
reason why people are entering. That's been startling to us.
Yeah.
But the big problem that we have with the outcome tool is that anyone who's turned away isn't answering those questions. And so that's why we need to go to administrative data, because we need to get their outcomes as well.
Right. Yeah. We're actually, the outcomes tool is measuring once you obtain residency, you're about when the person applies for residency, whether they get residency or not.
Yeah.
Yeah. Okay. Just wanted to make sure. And that's the point where the operator says, hey, we got this program, we got your application. It doesn't determine whether you're in or out, but you can, make yourself a quick buck by just giving you guys some information.
Yeah.
Yeah. Yeah. That's fantastic. Um, let's see. We do have another question. Will we be able to get a copy? Oh, yes, we're recording this PowerPoint, and I'll talk to Bill later. I'll contact you immediately afterwards with some metrics, but also um, whether you're going to get the PowerPoint or not. But we are recording this, and so eventually we're going to put it on our website so you can refer back to it.
Great.
Let's see here. Bill, I have no more questions.
Okay. Well, thanks for attending, and good attendance here. There's 31 people online. That's great. And thanks. And if you have any other questions or you want to participate in our research, Danielle can connect you with us. If you're interested in learning more about Leo, you can go to our webpage, leo.nd.edu. And we have sort of summaries of all the different programs that we have. And, a lot of my previous research has been in the drug crisis. And so I'm glad I'm able to sort of merge these together in this one project here. And so we're very excited about the opportunities with a high recovery housing.